we move from Marcus and philosophy and physics to pragmatic, to sport. The physical part of what you do, if you are all in sports medicine. Sports medicine is very special, different than any other kind of medicine. It has the best patients and the worst circumstances. And these patients, the theme of today is they need to return to play. I tell the practitioners who treat sports injuries, your job is to fix the patient so they can go out and break it again. Yeah? So I'll speak English slowly. So your patients are the best. They're fit, they're healthy, they're motivated, mentally strong, physically healthy, emotionally sturdy, up, down, fly, fall. All emotionally has to be the same. They have to recover. They are compliant. You say, do this, they do that. Yeah? And they always want more. A fraction of a second, a fraction of a meter, just a little more, right? And it, for me anyway, it makes me love them. And the problem is that they drive their body and their physiology right to the limit. They drive it until it breaks, and then they come to you. When it breaks, they need fast recovery, and when they recover, have you noticed, they want to be better than they were before they were injured. Yeah? So next time, they won't get injured. And they want it or need it yesterday, right now. So, sports medicine, more than any other kind of medicine, is medicine with a schedule. Tick-tock, now, tomorrow. Yes, I know, it feels much better now. And I have a competition in 10 days, right? Normally this is 3 months. And it is specific performance goals. The considerations for each sport are completely different than from any other sport. If you treat a gymnast, it is eccentric contraction and strength. If you treat rugby, it is concentric contraction and strength, sturdiness. If you treat a sprinter, it's different than if you treat marathon. Yeah? So, and for most of us, it is very high stakes medicine. The stakes in terms of prestige or money or a championship are very high. Sports medicine, more than any kind of medicine, is optimal physiology, injury recovery. So everyone gets injured. Everyone has to be repaired. Injury reconditioning. So not only do you have to repair the injury, they have to be able to perform as if they have never been hurt. This is different than any other kind of medicine. And they have to perform the same or better than they did before they were hurt. How do you do that? Yeah? So the goals, your goals, my goal, our goal as sports therapists is efficient conditioning. It's not just to recondition. It is to do more in less time. It is not only effective conditioning, it's efficient. Tick-tock. Optimal performance, and then fast recovery. Quickly. So our problem in medicine is the body. Without help, the body heals at a set rate. It's the same. Nerves recover 1 millimeter a day, right? Injuries heal by way. Normal injury healing is inflammation, leads to fibrosis, leads to scarring. In the medical literature, inflammation and injury reduces ATP. During repair, and that leads to scar tissue. So inflammation, increase inflammation, decrease ATP, makes fibrosis. What's the problem with fibrosis? Fibrosis does not stretch. Scar tissue. Once you make scar tissue, it doesn't stretch. It has to be remodeled, and elastin has to build slowly over time. Do you have time? Tick-tock. Fibrosis alters mechanics. The gymnast that I treated last week had limitation in shoulder motion, and he had shoulder pain. He had a mild tear. We fixed the tear. It took 1 hour. But the bigger problem was that he had adhesions between the long thoracic nerve and the latissimus. You know the anatomy, right? So the latissimus is here, the serratus is here, the long thoracic nerve runs in between the two. When he went to raise his hands, the shoulder had to work harder because the latissimus was adhered right here. When we dissolved that adhesion, range of motion was full, right? Fibrosis, scar tissue, especially to nerves, alters mechanics. And then fibrosis takes time to heal. So the old solutions were time, physiotherapy, massage, pain, training, reconditioning, over and over again to break the scar tissue, to build muscle memory, to make connective tissue, right? Heat, cold, pain relief, TENS, EMF, injections, prolotherapy, neurotherapy, applied neurology, tricking the brain into making everything work, good diet, maybe supplements, and meditation to bring the unconscious and conscious, to bring those together. That's the old solutions. Tick-tock. If you thought these solutions were enough, you wouldn't be here, I think. So, I have a new suggestion. It is a new treatment paradigm, a new treatment possibility that provides a new solution. So the new solution increases ATP, increases cellular energy by 500%, 5 times. It reduces inflammation, but it speeds healing because it increases production of repair tissue. It repairs injuries faster, and it improves performance because you have the ability to dissolve scar tissue between the nerve and the fascia. And that improves biomechanics. You can remodel scar tissue. When this phrase eliminates inhibition by dissolving neural adhesions. And that improves strength and it improves coordination. So do you know, I have to check with the concept, okay? So the patient was a marathon runner, and they brought her for treatment because her hamstrings kept being injured, because her glute max, the diagnosis of the doctor and the trainer, her glute max is weak. Primary hip extensor is weak. First, does it make any sense to you that the glute max would be weak in a woman who makes her living running marathons? No. So in my head, it was not the glute max. So they demonstrated that the glute was weak, maybe +3, -4. Wouldn't hold at all. I rolled her over on her back and palpated the femoral nerve between the adductors and quadriceps. Very painful, very tender, very tight. So we treated the nerve for inflammation, and we dissolved the adhesions between the nerve, the adductor, and the quadriceps so it could slide. 30 minutes, the patient rolled over, they tested the glute, +5, 100% strength. Was the glute weak? No. What was the matter? It was inhibited by the cerebellum. The cerebellum will not allow you to contract a muscle that will injure a nerve that is adhered. Does that make sense? And they had worked on her for 2 years. Why didn't they think of it? Why would they not think of it? They didn't have a tool. Because we have a way of dissolving adhesions between the nerve and the fascia, then it's the first thing you think of because it's so easy. Does that make sense? Yeah. So that improves strength, improves coordination. She was back to work in 3 weeks. Tick-tock. So this new tool is resonance and energy we call frequency specific microcurrent. Physics is nice. Understanding the philosophy is nice. I am a pragmatist. So the history is the frequency specific therapies were developed in the early 1900s, mostly by MDs and osteopaths in the US, Germany, England, and they were used by thousands of physicians until about 1934. But medicine that was trying to get organized labeled them all as fakes. It's all a fraud. Drugs and surgery were going to be the tools of medicine, right? Nutrition, herbs, homeopathy, frequency therapies were now against the law. Any physician who used them would lose their license. The devices went into the back room and got covered up with a sheet. And the research and the history were lost. We'll never know. There's no way to know. When grandfather died, the books on his shelf, the journals on his shelf, the journals in the library went in the trash, went in the fire. And the practitioners were persecuted, so they hid. Harry Van Gelder was an osteopath and naturopath who bought a practice in 1934 that came with a machine and a list of frequencies from 1922. George Douglas worked with Van Gelder in 1983 and brought home a copy of that list. And he put it in a drawer. Do you ever do that? You take the list, oh, I have to save that. You put it in a drawer. So, in 1995, I started practice as a chiropractor. And in Oregon, chiropractors have a very broad scope. I am licensed to deliver babies, do pelvic exams, minor surgery, just can't prescribe drugs. So I graduated in 1994, and in 1995, George was cleaning out the desk, and he found the list. Oh, and we had a microcurrent machine. So we resurrected the list and tried using the frequencies on the microcurrent machine. In 1995, I had to give up wondering how the frequencies were derived. How did somebody know in 1922 that 396 hertz was the frequency to address the nerve, and that 13 hertz would dissolve the scar tissue between the nerve and the fascia? How did that happen? There's no way to know. Also, there's no exact way to know how the frequencies work. I do know the 1920s equipment was not microcurrent. So we first used them in 1995, mostly to treat muscle pain. And the results were so good, I decided we needed to teach them to find out if they were reproducible. And by June of 1997, we found out that it was not only teachable, but reproducible. So since then, I continue to teach classes, and there are now 4,000 practitioners in 23 countries, all over. And the results and the stories are the same, consistent, reproducible. And then over time, the research in animals and in humans and the clinical results have accumulated over the next 20 years. So that's actually, to me, more important than what I've done. It's the fact that you can do the same thing, that it's teachable and reproducible. So the clinical response is very frequency specific. 40 hertz reduces inflammation in animals and in humans. It reduces pain, swelling, redness. The frequency for fibrosis and scarring just does that. Only increases range of motion, makes the tissue softer, only does that. Nothing else. The frequency for hemorrhage prevents bruising. In a new injury, the patient does not bruise if you get the frequency on soon enough. Toxicity changes function in patients who have been exposed to toxins but doesn't do anything to someone who is not having symptoms because of toxicity. And there's one frequency that's like a miracle. It's the frequency for kidney stone pain. Just the pain, not the stone, kidney stone pain. Pain goes from an 8 to a 0 in maybe 45 minutes. And it usually lasts for 1 or 2 days. So only one frequency reduces inflammation. How did somebody figure that out in 1920? I have no idea. So, but you can't argue with the data. Science is wonderful. Science is very pragmatic. One of the rules of science is you can't throw out the data because it doesn't match your model. Science is a method of observation, not an accumulation of data. It's a method of observation. So you do this and that happens. You do this and that happens. So once we had treated inflammation in patients, we went to Australia and we did research in mice. So you paint arachidonic acid on the mouse's ears and the ears swells up. And then you do something to the mouse. You inject him with something, you give him a pill, or in this case, you hold on to him with graphite conducting gloves, and you run 40 hertz on channel A and 116 hertz on channel B. And then, because you want to make sure it's correct, you put in a placebo frequency and you turn it away from the man who's treating the mouse. And it reduces lipoxygenase-mediated inflammation by 62% in 4 minutes. In 20 years of this research, no drug, prescription or non-prescription, has ever reduced inflammation by more than 45% in this animal model. So 62% is huge. In COX-mediated inflammation, it's 30% reduction, which is equivalent to injectable Toradol. It's a prescription non-steroidal. All the animals responded, and it was 4 minutes exactly. Half the effect was there at 2 minutes. The full effect was there at 4 minutes. And then no other frequency reduced the swelling at all. 1/10 of a hertz, just the current? No. Our frequency to reduce minerals in bone? No. Equivalent to placebo. Intermediate injury, our frequencies, no reduction in swelling. And then 40 hertz in the skin was no reduction in swelling. Why is that? Because arachidonic acid does not cause inflammation in the skin. It causes an immune system response, so it causes inflammation in the immune system, not the skin. Both the tissue and the condition have to be correct. So that was a big discovery. Microcurrent, just the current, as long as it's below 500 microamps, increases ATP production by 500%. If you go above 500 microamps, ATP is reduced, and it increases protein synthesis and amino acid transport to speed up tissue repair. Tick-tock. TENS reduces pain, but it also, because it's milliamps, reduces ATP. And this is the most important, for sports anyway. This was in rabbits. It's biopsy research. So you biopsy the rabbit, and then 1 hour a day, 5 days a week, for 4 weeks, you use just microcurrent, just 0.3 of a hertz, just the current. And in 1 month, it increased the vascularity by 39%, so the repair tissue is healthy, vascularized. Increased collagen by 14%. But here is the important part. It increases elastin by 48%, almost 50% improvement. What does that mean? It means that your repair tissue is going to be flexible. It's not just strong, it's flexible from the beginning, not 1 year, 1 month. So we have fibromyalgia patients, which are chronic pain patients, and we found a treatment that would help them. If you applied the frequency for inflammation in the spinal cord, 40 hertz on channel A, 10 hertz on channel B, I'm afraid to push the wrong button. It would take the pain from a 7 to a 1 in 90 minutes. This pain relief lasts any place from 2 hours up to 2 weeks. And 58% of these fibromyalgia patients recovered in 4 months. Fibromyalgia generally in the medical community is incurable. And for us, in this type anyway, 60% recover. Some of them needed a home unit. Most had physical therapy. You had to recondition them. And then when we presented this case report at the National Institutes of Health, we got blood work back that showed that 40 hertz on channel A and 10 hertz on channel B reduced all of the inflammatory cytokines, interleukin-1, TNF-alpha, interleukin-6, all went down by factors of 10 and 20 times. If you know statistics, the p-values, it's not coincidence. Substance P went down, endorphins go up. We don't charge extra for that. The patients get pretty stoned. Is there a German word for stoned? Dude, right? Yeah, like that. Endorphins went from 8 up to 71. Okay, so 40 hertz on A and 10 hertz on B reduces all inflammatory cytokines. In medicine, inflammatory cytokines are hard to change, and when they change slowly. 1 month, 2 months, 3 months. 40 hertz on channel A, 10 hertz on channel B, reduced all of the inflammatory cytokines by factors of 10 and 20 times. How did that happen? They don't do that any other way. We think this is the model for how it works. Cytokines are created by changes in cell signaling, right? When something lands on the outside of the cell, a piece of damaged tissue or a piece of a bacteria, it lands on this receptor, that changes kinases, that changes transcription factors, that changes genetic expression, and the inflammation is increased. Cytokines are created by changes in cell signaling. Only changes in cell signaling could normalize them so quickly. That's the theory. So we started with treating just myofascial pain and trigger points. If you have also, besides your sport patients, you have pain patients, 5 years chronicity, 11 treatments in 8 weeks. The pain went from an average of a 7 to an average of 1.5. Low back pain, 23 cases published, 8 years chronicity, 87% failed with other treatments. So even though it wasn't a controlled trial, it was assumed that if they were going to have a placebo response, they would have had it with one of the 6 people who treated the patient before me. So 6 visits in 6 weeks to have the pain go from a 7 to a 1.5. When you treat new injuries, genes turned on by the injury, by bleeding and by tissue fragments, are turned on by bleeding and tissue fragments. They are turned on immediately, and then they're off at about 6 hours. The late genes turn on, and they create fibrosis and scarring. They determine the rate of healing. We propose that the frequencies change these genes by stopping the bleeding and repairing the tissue damage and speed healing if the treatment begins within 4 hours of the injury. This is a woman who had a facelift, eyes, brow, mid-face, chin. Doesn't look like a bad idea. So And they treated her immediately after the surgery. So the surgery was well done. Drains, ice, all conventional therapy. And they treated her for 80 minutes with the new injury protocol, and then daily for 7 days. So you notice that there's minimal, very small bruising. Day 6, day 9. This is 11 days after a full facelift. Have you ever seen a patient 11 days after a full facelift? They don't look like that. Yeah? So Dr. Banzer asked me to tell the story of Terrell Owens. He is a wide receiver in American football. He runs and he catches passes. He has to be very fast and very agile. And he was injured on a Sunday, December 19th. He avulsed the deltoid ligament in his ankle, and he shredded the interosseous ligament that holds the tibia and fibula together, and he had an open spiral fracture in the fibula. This was a career-ending injury. They treated him immediately after the fracture with microcurrent, with a unit that he owned, and he had surgery on Tuesday, where they put a plate and screws to hold the tibia and the fibula together. They put the deltoid in place, but they don't even suture it. They just put it in place. They don't worry about it. So they called me on Monday morning and said he wanted to play in the Super Bowl in 6 weeks. And I did the math in my head, and they said, his doctor says you have to be the one to treat him because it's too scary. Great. So I got on a plane, and I flew overnight, and when he got out of the operating room, we put him in a limousine, laying on the bench, and we put the microcurrent on him for the 1-hour trip home, and we started with the frequencies to stop the bleeding. And we treated for 24 hours, from 8 o'clock in the morning on Tuesday until actually 10 o'clock in the morning on Wednesday. At 10 o'clock, so I slept on the couch sitting up. He slept on the couch laying down. At 10 o'clock in the morning, the team trainer came to the house and said, okay, let's see it. So we opened up the boot and we took off the bandage. And we looked at the foot that was injured. There was 0 swelling, 0 bruising. And I make this gesture because we looked at the other ankle, and they looked identical. Aside from being able to see the stitches, you couldn't tell which foot was injured. So the trainer said, how do I take advantage of what you can do? And my response was, you have to believe what you see instead of what you expect to see, because I've never done anything like this before. So we treated him 24 hours, and then another 6 hours, and then 4 to 5 hours every day. And the team trainer was good to his word. 3 days after the surgery, he was in a swimming pool, this deep in water, with a bag, a Ziploc bag over his leg, running on a treadmill in the water to reduce the impact. Day 3, 4, 5. I arrived on day 6, Monday, and this is what I saw. Terrell and his girlfriend were having a snowball fight in the front yard. He was wearing sneakers, running shoes, right? Trainers, in the snow. 6 days after surgery, chasing his girlfriend, throwing snowballs. So they started proprioceptive training. The surgeons said we were crazy. It would take 13 to 18 weeks or maybe never, and the Super Bowl dream was silly. At 4 weeks, Burkholder, the trainer, did fluoroscopy, movement x-rays, and ultrasound, and x-rays. The fracture was completely healed in 4 weeks, and the ankle, including the deltoid, was completely stable in 4 weeks. That's not possible. So at week 4, we started thinning out the fibrosis, making the tissue softer by taking out some of the calcium influx. But I was afraid to take out the scar tissue until just before the Super Bowl. So we got to the Super Bowl, he got there on Tuesday, and he couldn't run. I got there on Wednesday, like he ran 20 yards and his leg spasmed. I got there on Wednesday, his massage therapist got there on Wednesday, and we worked for 5 hours taking apart the scar tissue in his leg down to the bone, adhesions in the nerve, the blood vessels, the bone, the fascia, the ligaments, the tendons, clear down to the toes, from his knee to his toes. The massage therapist, Brian, describes it like bloodless surgery, what you see in, South America. It just dissolved. So he played in the Super Bowl 6 weeks after the injury and ran for 157 yards, which is a lot in a football game. And the recovery was judged impossible. When he was elected to the Hall of Fame in 2018, he thanked the FSM Dream Team for his recovery. So that's just a story. It's an impossible story, but it's a story. How do you turn that story into data? You create a study on delayed onset muscle soreness. It's as close as we come, 200 microamps. In 1999, Alan did a study in delayed onset muscle soreness that showed that plain microcurrent does not work at all. It's equivalent to placebo. Microcurrent, 200 microamps for 20 minutes immediately after this exercise had no effect to prevent or treat delayed onset muscle soreness. So we used 200 microamps, 20 minutes. Denise Curtis did the study. Stop the bleeding, 18 and 62. Treat to repair the tissue tears, torn and broken, 124. Then reduce inflammation in the immune system and in the muscle belly, the blood supply, the fascia, and the tendons, and then vitality. And this is the result. They had one treated leg, one sham leg. 24 hours, the treated leg, the pain was a 1, the sham leg was a 5. At 48 hours, the treated leg is a 1, the sham leg is a 7. At 72 hours, the treated leg is a 0.7, the sham is a 4. So, what does this mean for athletes that need to strengthen and condition? Bodybuilders, weightlifters, they train upper body on Monday. They are sore, can't lift a cup on Tuesday. They are sore on Wednesday, and they train upper body again on Thursday. So only 2 days a week can they do upper body. Then they can do trunk, then they can do legs. So they can be in the gym 6 days, but only 2 times in each area. If you can prevent delayed onset muscle soreness, one of our bodybuilders increased lifting capacity by 10% in 6 weeks. In his class, it was extraordinary. It was a big shift. And the problem is there's no other effective treatment for DOMS. So how does this happen with just frequencies and microcurrent? This is not physics. This is not philosophy. This is weightlifting. This is muscle injury. How does that happen? You have to have a rational model. So the genes, when you injure a muscle, the genes for repair are turned on by bleeding and tissue fragments, okay? That changes cell signaling. The cell signaling activates kinases and transcription factors that change genetic expression and create inflammation. Drugs and nutrients, which we're used to, act on a cell like a key and a lock. When you unlock your car door, it's a key and a lock. They change those receptors and reduce inflammation by changing what the cell does, by changing this receptor. Frequencies act like the key remote, changing the lock with an electromagnetic signal. It's the only thing that makes sense. It's the only thing that matches the data. So if you used a key to open your car door, that's like using a drug. Did you use your key remote beep, beep, to get into your car? Yeah? You used frequency specific therapy to get into your car, right? It unlocks this door, not that car, just this one. It unlocks the front door, not the back door. It's frequency specific. So the frequencies, we think, change genes and speed healing, but how do they do that? Well, then we go back to what Marcus was saying. Your body, as a body, is a Newtonian system. It behaves in accordance with Newtonian physics. What does that mean? It means that if we go up to the 12th floor and we drop you off, you accelerate at 32 feet per second per second. That is Newtonian physics. But Newtonian physics falls apart on an atomic level. Atoms. Newtonian physics doesn't work mathematically. So, what is this body made of? Well, you're made of biochemicals. You know from the books that you read that this tissue is made of biochemicals. And what are biochemicals made of? Molecules. And what are molecules made of? Atoms. What are atoms made of? Subatomic particles that are held together by electromagnetic bonds. So the hydrogen atom that is in your arm is the same hydrogen atom that's running around the linear accelerator in CERN. Same thing. It's subatomic particles held together by electromagnetic bonds. Every bond has a frequency at which it resonates. Every bond, every electrical, chemical, mechanical bond has a frequency at which it resonates. What is resonance? What is it? I use the word. What is it? It is the tendency of a bond or a system to oscillate at large amplitudes in response to some frequencies, but not others. At the resonant frequency, very small forces can produce very large amplitude vibrations. So in the 17 or 1800s, they found out that soldiers walking across a bridge in step, the bridge would start to vibrate and come apart. So when soldiers walk across a bridge, they break step. They don't march together. Why? Resonance. It's 100 men and a bridge. Small force, big impact. That's resonance. And you've seen the effect when a singer sings a note. I can't even come close. Oh, right? Singer sings a note that makes a lead crystal glass shatter. My chemistry teacher explained that trick. How does it work? It works because if the glass is 70% lead, has to be lead, the frequency that holds the lead atoms together is within the range of the human voice. If the singer can hit the precise note and hold it for long enough, the lead atoms begin to vibrate and the crystal glass just comes apart because of resonance. That's how powerful one note, one frequency can be. So in order for that note to spread in your body, for 40 and 116 to work, there has to be a conducting system inside your body. Water molecules, your cells are filled with a gel matrix, and water molecules line this gel inside the cells and forms structures that act like a semiconductor. The water molecules are attached to this gel and they flicker. Your cells are not filled with a liquid. They are filled with gel, like a gummy bear or Jell-O, right? They flicker. In the space where they flicker, there is a hole that's in exactly the same place every time. And it's just like silicon in your computer, germanium in your computer. The only thing that semiconductors have is a hole that is in the same place every time. Copper is a conductor, right? And that's because there are holes. There's two holes in the outside of the copper atom, whoosh, and the electrons travel. Ceramic, no holes. It's an insulator. There are no holes. Electrons have to have holes to move. Water makes a hole in the same place so that the current and the information can travel just like in your computer. So semiconductors convey current, charge, and information. So your body looks solid. Yeah, not so much. Not solid. Your body looks solid, but it's an electromagnetic system that functions like a semiconductor network. Your body conveys current, positive at the top, negative at the bottom, charge, positive in the middle, negative out here, and information. We think that the frequencies act like your key remote, opening a lock with an electromagnetic signal, and the frequencies appear to change membrane protein and configuration and cell function electromagnetically with a frequency-specific signal. So we know that frequencies can treat neuropathic pain. Honestly, nerve pain is the most difficult thing to treat in medicine, and for us, we think of treating it first because it's so easy, okay? It really is. So we have a small paper published, 65% of the patients recovered, even though they were 7 years chronic. They recovered in, 5 treatments, right? It's hard to get used to who you are. So 25% terminated care prior to recovery. If your pain has been a 7 for 7 years, and in 60 minutes your pain is a 1, who are you? So you have the potential of creating an identity crisis that is more or less unparalleled in medicine, even for athletes. Oh, my shoulder always hurts. Oh, my shoulder always hurts. Yeah, that one's just stiff. And when you dissolve the scar tissue and you repair the tendon tear in 60 minutes, the athlete has to get used to being different. And we know frequencies can dissolve scar tissue. So we've worked on burn patients. And in chronic burns, we did a study at a burn unit in, where was that? Springfield, Missouri. Every patient had statistically significant permanent increases in range of motion after 3 one-hour treatments. They were full thickness burns, any place from 3 to 7 years chronic. And every patient recovered. Well, improved their range, let's put it that way. The skin still looks scarred. So you see this man's arm is straight. 60 minutes before, it was bent 26 degrees. And then it's straight. Abdominal adhesion research in rats. 1 frequency dissolves the connective tissue in scarring. And we know that manual therapy combined with FSM is a powerful tool. So, when you dissolve the adhesions between a nerve and the fascia, what happens? In this case, that's Kim Pittis, our sports instructor in the US. This is an Olympic swimmer. He had a fall on his back that made adhesions between the kidney and the ureter and the fascia. And because of those adhesions, his extensor muscles were weak on this side, and he kept injuring his back. And in 60 minutes, well, actually it took 3 hours, but in 3 hours, she was able to dissolve the adhesions between the kidney and the ureter, and he returned to competition. So what does that mean for an athlete? Well, this is the study. That's how you turn theory into a paper. They did ulnar nerve transposition surgery. When he was 19, the pain was unchanged, reduced range of motion. Function was 86%. And they did lots of physical therapy, 11 therapy sessions, e-stim, ice, exercise, injections, and the pain was still a 4. At age 29, pain was worse. His range of motion was limited. He wanted to be able to hold his baby. His wife was pregnant, so he wanted to be able to bend his arm and hold the baby. So it basically took 3 sessions, 2 sessions, and then 1 session a year later, and his pain was a 0. His function score was 100%. The baby is now 3, and he still has no pain. So it means you can dissolve nerve and fascia adhesions that limit motion, strength, speed, and flexibility. So this is a slide from the FSM seminar, from the core seminar, and it tells the story of the marathon runner. Glute inhibition because of adhesions in the nerve. So when you learn FSM, the frequencies are done by the machine. The Time-Waver McMakin system is well programmed, it's easy to use. If you think, I want to dissolve adhesions between the nerve and the fascia, you put in nerve and it gives you the frequency. You put in fascia, it gives you the frequency, and then you just tell it how long to run it. So the machine does that. The thing that the seminar does is it teaches you to think. You would not think of increasing strength in the glute by dissolving adhesions in the femoral nerve unless you had a tool that lets you do that. So that's what the training does. It teaches you how to use the tool. So wound healing. This wound is obvious. It's a diabetic. He has necrosis in the toe. He is scheduled to have that toe amputated. They think maybe in 6 weeks, when they can do more, when it's worse. Wait for it to get worse. And in 12 treatments in 6 weeks, the wound was healed. In our world, with sports, a wound is a wound. Yeah? So you have an injury, you have a blister, you have a sprain, you have a bruise. If you can do this with a diabetic wound in 6 weeks, what can you do to treat wounds and injuries in your athletes? So to achieve lasting effects, you have to change the stable state. Stable state's a phrase that we use. So water is completely stable as ice as long as the surrounding tissue is 0 degrees. It's completely stable as a liquid as long as the surrounding tissue, surrounding milieu, is between 1 and 99. And it's completely stable as steam as long as the surrounding is 100 degrees, right? So the frequencies change the state of the tissue. It goes from hard to soft, from scarred to not scarred. And the changes can be permanent when the patient's metabolism and mechanics and attitude support that change. You change the pattern by changing the signaling, but you have to treat the cause. So treating inflammation in his tendon didn't do anything. Inflammation in the tendon doesn't do anything. Inflammation in the tendon is caused because of tears in the tendon connective tissue. That makes the cell change its signaling and express the genes that create inflammation. So to change the pattern, use the key fob, but you change the cause. So to treat inflammation in the tendon, you treat the tendon for being torn. Repair the tendon and the inflammation goes away. And then support the stable state. That's everything you already do. Diet, supplements, exercise, massage, all of those things just work better, faster, more efficient, more effective. So traumatic brain injuries in some athletes, especially skiers, soccer players, rugby players, sometimes gymnastics, right? So we know you can change the brain with FSM therapy. And if you could reconnect the brain after a stroke, imagine what you can do when frequencies enhance motor signaling in a conditioned athlete. So we know from experience and from research that only one frequency increases secretions in a specific tissue. This is increasing secretion in the ovary, and estrogen went from 1.7 to 37.1 in 30 minutes. That's the only thing that changed when we did increase secretions in the ovary. Well, this is a 38-year-old patient, 3 years after a stroke. She's young. She had spastic paralysis in the upper extremity and the typical stroke patient. Adductors, flexors, right? And we thought if we can increase secretions in the sensory and motor cortex, it would relax the spasticity and improve sensation. And that is exactly what happened. Only when you ran the frequency to increase secretions in the sensory and motor cortex in 30 minutes, took time, but in 30 minutes the hand relaxed and the spasticity was gone. In 60 minutes, this is a physical therapist who is passively ranging the shoulder after 3 years of being contracted. And then after 90 minutes, this was without the machine on, and she had active range of motion. And then she said, oh, the glove is gone because sensation came back too. Right? And then I didn't believe it. Yeah, no, that's not possible. So that was Tuesday. And then we taught the course, it was Wednesday, and we taught the course in Taiwan. And then before we caught the plane on Monday, I wanted to see her again. We needed to know, would this last? Would this be permanent, right? So we went back, and the hand was spastic, but she still had this range. Hand was the last, but she could get her arm up like this. Kathleen, the PT, physical therapist, worked on the shoulder muscles and further increased active shoulder range of motion. And this is her at the end of 1 hour, right? And when I emailed 5 months, 1 year later, still, it's good. It's been permanent. They're working on the leg, and I haven't heard if that works. So if you can increase secretions in the sensory and motor cortex, and if you can modify secretions between the brain and the body, and you can increase secretions between the cerebellum and the motor cortex and the body after injury rehab, you can improve coordination and performance. So it is extraordinary to rebuild somebody's shoulder and watch them struggle to be coordinated, and then run the frequency to increase secretions in the cerebellum, and the movement coordinates, but the patient looks confused. Then you increase secretions in the sensory cortex, and the movement is smooth, and the patient can coordinate it deliberately. And then training takes over the rest, right? So I was smiling and looking in the back. There's a student who took the class last week in Berlin, and she showed me a video of a patient. How old is he? 82. And she has video of his shoulder was frozen. It was like this. How long? 1 hour? About 1 hour. And she has video of his arm like this. Because you can dissolve adhesions between the connective tissue and the nerves, you can increase range. So how do you do that? Thanks to Time Waver, we have the pain management textbook, and the resonance effect is full of stories. It's how FSM developed. It's how it comes here. And yes, it does work on horses. That's my horse over there. Yeah. It works on horses. So if you can increase ATP production by 500%, if you can reduce inflammation, if you can speed healing, repair injuries faster, improve performance by dissolving fibrosis and remodeling scar tissue, if you can eliminate inhibition and improve strength and improve coordination, you can improve performance. And if you thought the old solutions were enough, this group especially wouldn't be here. So, when you need a new solution and you need to return to play, change the game. Use something new.